Joining us now is one of India's finest doctors, Dr. K Srinath Reddy. He is President of Public Health Foundation of India and worked for many years at the All India Institute of Medical Sciences. So, first question, suddenly a spate of deaths, that adds to a bit of panic. Why is that? Why is it happening?
Yes, I think because the outbreak is relatively recent and the deaths have started appearing of late.
Right.
And each day, if there is an additional death or two,
right,
then automatically there is an increased sense of alarm in the public.
Right.
And particularly if there has been some suspicion that either the diagnosis was delayed or treatment was not instituted at the appropriate time, then naturally the sense of outrage also accentuates the panic.
Yeah. Generally, when a patient dies, the family are dissatisfied and they find errors in the hospital. It's a general problem, not just in swine flu, and it's happening here again. But the statistics we've got that 4 in 1,000 die of swine flu, and ordinary flu 4 in 1,000 also die. So is it just like ordinary flu?
Well, as far as swine flu is concerned, the organism is considered to be highly transmissible but still of low virulence at this stage.
Okay.
Even in Mexico, where 17,000 cases have been now diagnosed,
right,
the number of deaths are less than 0.8%.
Okay.
Possibly even less, because
8 in 1,000 there, where it's the worst.
No, but even there, the number of cases that were actually infected may not have all been tested, because in many, the symptoms are subclinical. People may not even go for testing. So if you actually take the total numbers that are likely to have been tested, it's likely to be closer to 4 in 1,000.
Right, right.
But
a lot of them are not even
But the
reported.
problem about swine flu is that not only it's antigenically different from the usual seasonal flu viruses,
right,
but because it has animal reservoirs and it has a tendency to cross-connect with viral antigens from other viruses, leading to new strains, we have to keep a close watch on it. At the moment, it's a low virulence strain.
Low virulence strain. That means at the moment it's not very dangerous.
It is not dangerous.
Right.
In the US, for example, where they categorize it just like the hurricane categories of 1 to 6,
right,
it is still rated as category 1, which is the lowest.
1 out of 6. 6 is the highest and this is just 1. And would you rate it about 1 out of 6 in India as well?
Well, it's still evolving at the moment. Therefore,
right,
it's difficult for us to say. In the US, for example, there have been about nearly 350 deaths so far.
Right.
We have not yet seen it fully evolve. But at the moment, we would still rate it as a low virulence strain.
Okay. Let's go to our first question for you, sir. The first question we've been asked to ask you by all our viewers is, how do we stop the panic in India? We've seen across the world people are behaving normally, no masks at airport, nothing. But in India, there is widespread fear. How do we stop this panic? How do doctors reassure patients when they meet them that don't worry, and the parents and the family don't worry?
Firstly, there is a fear of the unknown.
It's the unknown more than anything, yes. And
secondly, the suddenness of this whole episode coming up, sequence after sequence,
right,
one after another, city after city, that's actually leading to this kind of a panic. But if we understand that it is in the nature of this virus to spread, and spread fast,
right,
but not necessarily to kill, and those who die are very likely to be immunocompromised or have other diseases, then the feeling of vulnerability is much less then.
Right. So those who die generally have some other complication. And when swine flu comes in, they die, well, out of a combination of both, right?
Yes, are much more likely to die than another person who is otherwise healthy and might have acquired swine flu.
Okay, the second question we want to ask is, swine flu versus ordinary flu. What is the difference? Everybody wants to know, is there something huge? Is there something unknown about swine flu that makes it much more dangerous than ordinary flu?
Tuba.com